that sterile processing get involved and get involved in that multidisciplinary team for managing that water. We're also going to talk to you a little bit about designating and developing water super users. We're going to talk about utility, critical, and steam. We're going to show you when we've combined several of the charts in 108 to two specific charts of when do you take the test and where do you take the test and what those values or parameters should be. We're going to tell you how to get the sample as well. So, and how to gather that. The why is, we've all seen these pictures, these water droplets staining, rainbow colored on equipment or instrumentation, and it's often a sign of underlying problems with water or steam quality. So imagine you open the mechanical washer and you see all this spotting, chalk all over inside of it. Many times when our team goes and assesses sterile processing departments, we see this, and it's so common to the technicians or to the sterile processing department that they just take it for granted that's what it is. But it's really an indicative of a water quality problem. And so we're going to show you how that chalkiness or that stain or rainbow colored in some of this equipment can be remedied. We've all seen this, the result of poor water quality, marbling, spotting, staining, blackening on instruments. And that blackening, I'm telling you, we all come from the operating room at Advantage, we would return that instrument to you. We would not use that on a patient. So what we're suggesting is that if we develop, your department begins to develop and initiate a super user or champion in your department, you can begin to address these problems. And they're going to have resources and the where to go get those resources and how to begin to correct these staining issues. We've always assumed that plant operations takes care of the water, but now it should be SP or sterile processing as well. So for the last year, we've gone to many conferences, done a lot of speaking at chapter meetings and different AORN meetings. And what we're hearing is there's a lot of angst and fear about 108, standard 108 from AAMI. And who's going to do it? Why are we going to do it? How are we going to do this? And what do we do with it? So this is really to initiate just a baseline. It's not a lot of the science that's involved in water. It's just the baseline of how to begin to manage and understand the water. The number one tool we've always used in sterile processing and have known the least about, because biomed or facility engineers have always taken care of it on their side of that wall. So we're going to talk about how to communicate for both sides of the wall, the facilities where the boilers is, and also in sterile processing. Why should we learn this? Why do I need to bother to learn about science? Because it directly impacts the effectiveness of sterilization. Poor water quality is characterized by high microbial content and improper chemical compositions, potentially compromising the sterilization process, which is back to that screen I showed you a couple before, which is, wet loads, staining, that blackening, the chalk in the mechanical washer. And this definition is not Angie or Advantage saying that, this is directly from the CDC. We gain the knowledge needed to implement proactive measures. We don't want to wait till this, ceiling is falling in or sky is falling for us to begin to manage water or to begin to understand water. We want to monitor and control the water quality parameters, such as those microbial levels and the chemical composition, and it mitigates infection risk, which we're going to talk to you about in just a minute. And developing that super user in your department is really going to just begin for them to familiarize themselves with 108. It's not all or nothing. It is in stages. There's a learning curve here. Hospital-acquired infections, HAIs, can be caused by poor water quality. Legionnaires from 2000 and 2009 increased significantly, and Pseudomonas and resistant organisms further emphasize the importance of stringent water quality. Legionnaires, components of water systems, are found in those dead legs. Okay, what are dead legs? So you can kind of see this picture. There's a curve. We're going to show you another one too. But there are places in that piping that the water can get stagnant, create scaling. It can gather and harness sediment that's then with a gush of water released into your water that's coming out of your tap and in the decontamination sink or into the washer. Patients who contract the Legionnaire's disease typically have underlying conditions, and these are our surgical patients, organ or stem cell transplants, chronic COPD, immunosuppressive therapy patients. Pseudomonas species commonly found in water sources and associated with biofilms. And we've all learned about biofilms initially, just like water. We had to learn what are biofilms and how do they get into the lumens of instruments or into this piping. So Pseudomonas can gather there. Hand hygiene, we've all done a great job. Sterile processing and, of course, the operating room, wonderful at performing this task many, many times throughout the day, but is the most critical measure to prevent gram-negative hospital-acquired infections. The transmission can occur if your hands become contaminated. So let's say we didn't manage the water and these organisms are coming out through the tap water in our decontamination sink. We're actually adding more chemicals and more potentially harmful organisms into the water that we're trying to break down those lipolytics, proteolytics with our detergents in that decontamination sink. Non-tuberculosis mycobacteria, NTM, result from tap water rinsing, and it's resilient to organisms in municipal water. And so let's talk about that. There's opportunistic molds like Aspergillus that we found in hospital water and plumbing fixtures. So all of these, we've gone to hospitals that have had 100-year-olds piping, 100 years old. And you think about what's gathered there and affixed itself to the inside of that piping. So this approach to understanding the why requires a multifaceted approach. It's not just facility engineers anymore. It is the hygiene practices and clinical strategies. We need to jump in to that team to understand both sides of the wall and what's happening with the water from the boiler versus what's required in sterile processing now. Does this mean me? We already have in sterile processing so much to do, usually with very little staff. And now we're documenting all of these other things, sterilization records and other things. Now we have to start documenting and gathering these samples as well. If your multidisciplinary team chooses sterile processing to gather these samples, some daily, some weekly, who's going to do that? So again, while it doesn't specify who's responsible for this in 108, we're highly recommending a super user become developed and initiate to the 108 standard. That super user and champion's role would gather the samples, document the results, and serve as initiating the expert level for water quality needs and the requirements designated by 108. Compliance, sustainability. So a super user, it doesn't mean, remember, this is a learning curve. So it doesn't mean that everybody in sterile processing has to learn the science of water. But if we develop and initiate that super user and champion, they can then start to initiate other levels in sterile processing to help troubleshoot, identify lots of in-services and things like that that we can do to begin the education. It's really going to address problems also of not just staining, but those wet loads and why they're doing it, and determining the cause of those wet loads. We're going to provide resources to those super users so they know who to call and how to mitigate those wet loads and begin that research to fix that problem. The SPD staff, water samples in the department at some distribution loops or manual sink. And what I mean by that is we're going to show you where the distribution loops are. That is the water coming out at the end before it hits a mechanical washer, a decontamination sink on bay 1, or the third bay, which should be critical water. And we're going to talk a little bit about that. The poor water quality can lead to residue buildup, corrosion, and compromise the instruments, not just staining, but their functionality as well. The steam that we're going to test, there's a picture here. One of the water quality assessments we've done, many now, we call in an expert in the country that helps us determine the steam quality, and this is a test. We are not recommending that sterile processing do this. We're recommending that if facilities engineers, if they're acclimated to that science and know the process, or a third party, if they're going to do the steam quality test, or call in the consultants like we have. And we're going to provide some 2 people that we know in the industry that can help you do that. So now we're going to start communicating. The test from the water samples. Okay, so facility engineers is testing water every day. And then you might have a third party that comes in once a month or once a quarter that does other testing as well. Now we need to really combine those efforts, understand what do those results mean when they show us conductivity, pH, or whatever they're showing us and they're testing for. We need to start to understand what those values are and if they're within the parameters required for sterile processing. Once it gets through all those pipes from the boiler, through the walls, and into our decontam sink, or into the back of our washer, or even our sterilizer. So there should be set clear expectations on regular reporting between these 2 teams, facilities and sterile processing is what we're recommending. And there should be timely interventions. It's really fostering a culture of excellence for our patients, but also for ourselves. Remember, some of those organisms can get just on our hands. So we're really going to start communicating and gathering information. One of the things we've suggested to many of our clients when we've done water assessments is for sterile processing to go around no more than 30 minutes. Call the facility engineer, biomed, and walk sterile processing through that side of the wall is what we call it. So that side of the process, from the piping, from municipal water all the way through the boiler and out through that big red pipe that goes through that wall to the hospital, and vice versa. Sterile processing should invite facility engineers to understand the standards we now have to uphold to from 108 and AAMI, that they need to understand how to help us mitigate. Utility water, these are the definitions. This is what's in 108, the 3 types of water. Utility is suitable for the initial stages of pre-cleaning. And you can see a sink here. This is a 3-bay sink, the first picture on the left. 3-bay sink, utility water should be going into the first and second sink. The third sink should have critical water in it. And that's through a filtration system that you have somewhere in a closet or a back room in your sterile processing department, if you have one. If you don't, please reach out to us. We can get you some information and resources to get that critical water process beginning. And this is the holding tank that you can sometimes test from, get your sample from, and sometimes it's just going to a line that you can follow to the bottom of the decontamination sink that you can identify if you have critical water or not. And then again, steam, purified for generating steam in autoclaves. It's crucial for effective sterilization. Impurities of steam can affect the sterilization process, as we all know, and the instrument integrity. Okay, municipal water checks. So there should be a record. You can call your local municipality and ask them for the record of when they do daily tests. Your municipality does daily tests, and then they'll do monthly or quarterly as well. And you should be able to get that record. And that is what is coming through your wall before facilities treats it with salt or any other treatment that they do before and after it gets to a boiler. So let's get the baseline of what kind of water are you receiving from your city. And then additional risks are can be performed by the engineers, or again, that third party consultant that's going to talk to you about dead legs and old piping or water main breaks and seasonal changes. So a lot of us live in areas where there's dramatic seasonal changes, and that can affect the water quality coming from municipal water, as well as water main breaks. We went to one hospital and the water main break was a couple blocks away, but it affected the water for that hospital. So we're going to check and contact the city to see what's going on in your city as well. And then there's feed water that should be collected at various points of the treatment system. So it's after you've softened it, and after, if you have RO or DI, and at the point of that water, feed water, getting to the final rinse water, which you can test it at your third base sink. There's a water distribution system. We talked about a little bit earlier. If you have a filtration system and it's incoming water, you're testing it as the water comes in before it's treated, and then after the treatment step, and then again at the point of use. Now, remember we talked a little bit about how to identify if I have critical water in my sink. There is a faucet that comes straight from the filtration system or the feed water tank that you can test it right here at your third base sink. So you're going to test it at the point of use as well. Sampling at the delivery point, understanding the sampling points. So initially, let's say you've designated an interdisciplinary team for water and begin that water quality system. You've talked to one or several people in your department about their interest in becoming the champion of water for your department. And the next step is go assess. Go assess where all those distribution loops are. Defining the distribution loops and sample sites ensure water quality monitoring is proper, both entering and exiting the system. Again, this is the storage tank on the right for your filtration system that's feeding your washers. This is all the critical water. Sometimes it'll have a valve on it. Sometimes it doesn't, depending on what storage tank you have. So you can help work with your facility engineers about gathering those samples. Again, steam. We suggest thermodiagnostic. There's also another expert in the in the country, Jonathan Wilder, that can help you get those steam samples. And that's who we usually recommend. Walter Deacon through Thermodiagnostics or Jonathan Wilder. The how is gathering the samples. So now we begin. The samples within the water distribution set, let's get a baseline to establish a water quality baseline. And that is collecting before the disinfection or before the RODI treatment. You're going to just get a baseline of where are you before we touch the water. And your facility engineer does do that. From the time they get the water before it's softened and into a saltwater tank, they will get a sample to let you know about your municipal water, just to get a baseline of what's coming through that wall from the city. Water sampling begins at identifying key locations. This includes beginning and the end of every distribution loop, before it's treated, after it's treated, and then at the point of use. If it's the third bay sink at your critical, or your facility engineers or that third party can also get it from the back of a mechanical washer. So let's get ready to collect the samples. Before sampling the valves, taps, and hoses, you can disinfect those externally. You're going to flush the water before you put it in the container, and the container has to be endotoxin free. The sample should be promptly stored after you gather that sample. If you have a new distribution water system, including the storage tank, if it's new for your water filter, you should drain and flush the water and any residual disinfections before collecting the sample. And this is annually, or if there's seasonal changes, you're going to do that. If it's new, you're going to culture this weekly until you establish a baseline of consistent parameters and values. And if it's established, then you can test it monthly. The samples within the water distribution system. So let's get a sample. The samples are collected directly from the outlet taps. You're going to open that tap and you're going to run the water for 60 seconds. And then you're going to collect it again in that endotoxin-free containers. The containers cannot be made of polypropylene. It really inhibits the detection of endotoxins. You're then going to store that sample. If it's going to go to a lab, you're going to store it at 4 degrees Celsius. And these meticulous sampling practices are essential for SP professionals. So I wrote that in here because when you're developing the super user or champion or whoever's going to gather this sample that you guys have determined from your multidisciplinary team, they can't skip a step. They really have to be very meticulous about how they're gathering the sample and either storing it or gathering the sample to test within house. The mechanical equipment and sterilizer. Okay, so in 108, we now have to document if there's residue, scaling, or staining every day. This is an everyday thing. So for example, here's a hypothetical. Once your technician is going through and doing all the Bowie-Dick tests or the biological testing for steam sterilizers or even autoclaves, if you still have them, they can now document this as well. They're going to go through and visually inspect all of this discoloration. They're going to focus on the spray arms and internal chambers of the washers, as well as the AERs, ultrasonics, and the sterilizers. So we have a little chart that lists all the equipment, and then you can go through and put your initials through to check positive or negative if there's any of this in your equipment daily. So here, what again? I wrote it like this because documentation is already overwhelming sometimes, and now we have to document more. So this chart on the right is something you might see from your facilities when they're testing for the water treatment before and after a boiler process in their department. And so, although we're adding more tasks, might seem overwhelming, thorough documentation ensures that this is done. In nursing, we say, if it's not documented, it's not been done. So we really have to start documenting this. So comprehension of these documents, this is also part of your conversation with facilities, learning 108, learning what these tests are and what the values mean is beginning, again, that learning curve for your super user and champion in your department. So pH, we're going to sample, should be taken again at the distribution loop, point of use, quarterly for utility water, monthly for critical water, and quarterly for steam. And you can get a device in your department and you can test on your own. You don't have to send this to a lab. Conductivity, total alkalinity, or the hardness. 108 designates that utility water is quarterly, critical water is monthly, and quarterly for steam as well. Bacterial testing, you can see this chart at the very bottom right here, and I'm going to show you with that, and we'll also share it with you with a link at the end of this presentation. But what we've done is we've combined a couple of the charts in 108 to have a one-stop shop view of, okay, what are we testing? When are we testing? What should it look like? And then what does a visual test look? But if we're just looking and talking about bacterial testing, you're going to test quarterly for utility water, and that is literally from the decontamination first base sink, and monthly for critical water, which can be at the third base sink if you have it in your department. This is not applicable for steam because endotoxin testing doesn't require for this type. So here's one of the charts. We've combined table 4 and 5, monitoring water generation system. This is from your filtration system if you have it. You're going to test these elements: pH, conductivity, total alkalinity, hardness, bacteria, and endotoxin. So if you have any questions about this chart once you receive it, I can help you with this. Just call me or email me and I'll walk you through it. But pH, you can see, should be 25 degrees Celsius, 77 Fahrenheit. Utility water should be 6.5, I think, to 9.5, and it is quarterly. And then critical water starts actually at 5.0 monthly. So you can kind of see the checkpoint and check mark, and you can line that up. Again, if you have any questions about this chart, please don't hesitate to reach out and I'll walk you through it. Table 4 in 108 is water quality requirements, and table 6 is the frequency for the point of use testing. And this is pH, utility, 6.5 to 9.5 quarterly. That's what you're going to do. pH for critical, 5.0 to 7.5 monthly. Steam, you're going to have, again, those engineers or third party or those independent consultants I talked to you about and recommended, 5.0 to 9.2 quarterly. And you can, again, go through this chart. We'll share it with you. And if you have any questions, reach out. Visual equipment. Again, remember, this is daily now. Spray arms inside the chamber walls and inside the machine. Utility, daily, you're going to look for residue, staining, scaling, and discoloration. Critical, you're going to look for residue, staining, and scaling and discoloration. And steam, you're going to look for colorless, clear, no residue, no sediment. That's what you're looking for. There's an ionic chart here for the ions that we're testing: chloride, phosphates, sulfates. And as you go through the education portion of this Advantage program, you'll become familiar with chloride. What is it? Where does it come from? How does it get into my water? and how does it affect my instruments? Why do my instruments look a certain way? So all these main feed lines in the facility we're going to test, and these are the parameters for each one of those. Here's some questions that you and your team can kind of get together and just have a discussion about, and just ask yourself some of these questions. What questions should you ask facility engineers when you're talking about the water quality that's left their side of the wall, gone through all the piping to your side of the wall? What questions should you ask them? Do you know the water quality coming in from the municipal sort? Have they gotten a record of the daily test or the quarterly test that they do? Or do you have one? You can reach out to them again. Does your SP have a record of a monthly or quarterly values for your water, SP water, coming from that distribution loop, the tap at the utility water, or the third bay, or the back of your washer? Where is your record? Has the SP been engaging in a multidisciplinary team? Are you at the table to ask the questions? What questions should you ask? And when they give you the answers, what does it mean for you? And this is all, again, a learning curve that we're educating both the facility engineer side, biomed, and sterile processing side. And does your SP have critical water? Let's determine that first. If you have staining or spotting, has your SP resolved it using OLLI critical water for all processing stages? Now, the reason I'm asking this is initially when we're getting a lot of staining or spotting, one of the first things I've seen many of our clients do is change all water to critical. And it does affect change and help solve that. But it's not a long-term solution, and eventually is going to damage some things in your instruments or even in your piping and machines. So let's talk about that, if that's your resolution that you've made now, currently, or even before. If you have any questions, don't hesitate to reach out. Advantage has developed what we've talked about throughout this process, a water quality assessment to let you know what's going on. We bring in one of those STEAM experts with us. So we're doing a utility, critical, and STEAM testing and giving you those results. There's also a training package to help initiate that SME or that champion in your department for water to start to manage and learn how to manage that water. We have a staining assessment, and we have a wet load study. This is my information. You can reach out to anybody at Advantage Support Services. Most of you know us well already. Here's a QR code that you can click on to reach out to. This is one, we recommend that you take a picture of this QR code, and at Advantage, don't hesitate to make us your first call. If we cannot help you, we're going to get you to the people that can, but most of the time we have a solution for you. So don't hesitate to reach out to us. These are some references. If you'd like this PowerPoint, you're more than welcome to it. Reach out to me and we'll send it to you. Thank you so much for your time.